Hello, my name is Andrew Kohlmeyer, and I'm at Andrew Kohlmeyer Massage, and I'd like to talk about uh, hand pain or arm pain, possibly carpal tunnel, and I would like to demonstrate on how to massage that out. So, what happens is you have overloading in the arm, which comes down, and that can come from higher up too. So, a big problem with that is the biceps tendon right here. So you'll feel like there's a little groove where that tendon is, and you just want to kind of crush that stuff up in there, and that can carry right down into the thumb. So it's important to get that, and it's also important to get this so it doesn't just keep happening. Like when you push off something or you pull off something, you get that big zinger in your arm. So you want to make sure that you don't carry on with your activities. You spend that 10 to 20 seconds and grind out that material that's in the tendon sheath of that. So it's like a bicycle cable. It's a cable and a cable. So you just want to make sure that is cleared out so you don't have that pain. So yeah, and another thing for the upper arm is the medial side here can get mineralized, and that's basically your brachial plexus, and that carries up right up through the shoulder and into your neck. So if you keep having problems in the neck, you're not going to really resolve it completely until you clean this stuff out. And you can kind of just, kind of feel what's in there and kind of get that out. It'll feel pretty crunchy. And these muscles never see the sideways action, so you can always just kind of grind that stuff out of there. So, yep, just give that a good shot there. And basically, your hand is everything that controls your hand is right between the bones. So this is your radius and this is your ulna. So everything is in between those bones. So you can see if you're having weakness. I mean, you probably know, but you can make a fist and then you can pinch in here. And if it's really tight, you want to reduce that space between the bones, because you won't have enough compartmental space to make these actions of your hand, free, so that you don't have pain on extension or flexion or anything like that. So the easiest way to do that for yourself is you just lay your hand or your arm on top of your fingers and just move them both, and you'll just grind that stuff up that's in there. Same for the extensor side. You can hold it against your body to get some more leverage on it, and just kind of get that stuff out of there. Between the bones is, primarily where you're going for, right in there. So you feel like you got that pretty well good and set. You're going to have mineralization into the wrist. So you're going to want to just take a finger and brace it with a finger next to it. You just kind of dig that stuff out. So, it'll feel crunchy. You're not going to hurt anything in there. Everything is there. That's in there is incredibly strong. Then you have the hand itself. So you have the web of your thumb. That can get super painful and just kind of laggy. You don't really have free movement. So you can pinch in there, pinch that web, and just, you'll feel that mineralization in there. And the mineralization I'm talking about is from repeated cycles of inflammation that just leave that material behind. So you want to pinch that out. And a good way to get like this edge, in here is to, kind of hold your thumb in, and then you can kind of just rub up on the side there and kind of get that mineralization out. And just the pinching, you can feel like the attachment right here for this whole web of muscles right in here. And once you get that cleaned up, it's like, whoa, you got like so much more, free movement. You're not gonna wear your thumb out doing like tasks that require a lot of like pinching and stuff like that, crafts or whatever. So yeah, and then we have the finger joints itself. So basically, how the finger joints work, there's like a magazine that goes across there. And what I mean by a magazine is like the head of like a shaver. Like a disposable shaving thing. It's attached, but it's not really attached. It's only attached like minimally. So, so what happens is between that magazine, which holds your tendons from either side, is that gets mineralized underneath it. So you just want to kind of pill roll that, and you'll feel it. It'll feel like, I'm not really doing anything. And then all of a sudden it'll be like, oh yeah, there's something going on there. So you're going to want to keep pinching that out. and just break up that mineralization. That's like, you know, the joint down here, kind of, especially if you're pushing on something a lot, you know, it's really easy to get that mineralization, and you're just like, oh my God, that just really hurts, you know, super painful it can be. And you pill that roll out, you pill roll that out, and yeah, that'll be the end of that pain there, you know. And I can feel like I have some in there myself, you know. It's pretty common to have some in there, but yeah, that's you know, really important to do that so you're not you know, just in pain all day. And let's see, what else can we do? So the thumb is basically like a horseback rider sitting on a saddle. So you can go around that thumb joint and just pick out stuff that's in there. And you can kind of move your thumb around and kind of feel what that's like, you know. And if there's any mineralization in there, you want to try to get that out. You know, just try to get that saddle cleaned up so that rider, you know, can move around freely without, you know, causing any pain. Especially like you grip something, you're just like, and you gotta like almost let go, you know. So yeah, that's basically it, you know. So yeah, that's a good way to have trouble-free arms. And once you get it, you know, where you're like, you know, pretty well set, you can test it. You can just shake your arms really good, and if you have any pain up in the forearm, that tells you immediately where to work. Okay, I need to do some more work there because it hurts. So that's the good cheater way to figure out what is going on with the arm. So that's it. So that's my little talk on arm pain. All right, hopefully it helps you out.